Good morning, everyone. Thank you for being here almost afternoon now. I'm Kyle Davis, the Government Relations and Public Policy Specialist for the Greater Binghamton Chamber of Commerce. I'd like to welcome you to this webinar on the COVID vaccine information for employers. We will have a Q&A at the end, and feel free to unmute yourself then. And if you have a question, feel free to put it in the chat as well. Our speaker this morning is from HH&K, Dawn Loanette. She is a partner at HH&K and is chair of the firm's Labor and Employment Law Practice Group. Dawn also participates in the litigation, healthcare law, and cybersecurity practices at HH&K. Dawn primarily advises both unionized and non-unionized employers on all aspects of their relationship with their employees and represents employers in state and federal courts and before administrative agencies. I'd like to thank you for being with us this morning, Dawn, and I will turn it over to you so you can get started on the meat of this presentation.
Absolutely. Good morning, everyone. Just a couple of technical things. If you would like to unmute and ask me a question while the program's going, that's perfectly fine. Alternately, you could type questions into the chat, either to me or to everyone, and I will do my best to answer those as we go. Well, today's the day, 30 and up, pretty exciting. So I'm hoping everyone got their vaccine appointments at 8 a.m. this morning. If you did not, I checked just before we started, and there's lots of appointments starting in May over at Binghamton University, or you can go to, maybe you want to take a day trip to Corning or Syracuse. Let's get started. This presentation is not intended to be legal advice. It's for information, hopefully educational purposes only. This may be considered attorney advertising, and you should not rely on it as legal advice. Please contact an attorney to discuss your specific situation. This particular set of slides requires a second disclaimer, which is that this presentation might be obsolete 5 minutes after it's finished. This is an ever-changing situation, and the rules and guidance are changing all the time. Please monitor the news for legal updates, the governor's office, Congress, executive orders, etc. I say this a little bit tongue-in-cheek because some of you get really tired of listening to the disclaimers every time I talk. But every time I do this slideshow presentation, the day before or the day of, something changes. It's always exciting to keep up. Let's talk about vaccine eligibility in New York. 30 and over as of today can get vaccinated. Residents of New York. Soon it will be 16 and over. Comorbidities still applies. Public-facing essential workers from government and nonprofit entities. That might be important for some of you who have people who are residents of Pennsylvania, but employees in New York. Right now, the only ones who would qualify for vaccines for Pennsylvania residents and employees of New York, but employed in New York, are these public-facing essential workers. And for non-nonprofits, the public-facing essential building services workers. Those are the only ones that are going to be eligible right now. I know it's tough out there. I've heard that right over the border in Pennsylvania, there are not a lot of vaccine sites. But let me give you a little bit of help for that. Here's Pennsylvania eligibility rules and their tracker. So you can take a look at that if you are trying to help an employee from Pennsylvania find, a vaccine site. 50 state guide to potential law regarding mandatory vaccines. I'm not going to cover any state but New York today, but if you have employees in other states, Hush and Blackwell has decided to try to keep up on that. I wish them luck. And then this last article is a bit outdated. I just want to make you aware. It was the 50 state guide to vaccine distribution plans. I include it only because it has the links to the Departments of Health in the other states. And so you might be able to use it to track down vaccine information in another state. Hey, let's start with paid leave for vaccines this morning. What do employees get, or you want to let them know about to get if they're going to get vaccinated? The first is that New York recently added a vaccine leave. It's going to be Labor Law 196C. It will be up to 4 hours per shot. So for people getting Pfizer or Moderna, they're going to get that up to 4 hours twice. For people getting Johnson & Johnson, which I didn't see available yet in our area, but will be coming soon, that's going to be a one-time. It's paid at the employee's regular rate. It is available for both exempt and non-exempt employees. And you cannot replace it with other leave. So if you offer PTO, you offer something else, maybe you offer COVID leave, you can't replace it with this. New York sick leave, this is a separate leave. It won't take away from the employee's leave. In terms of asking for documentation, you can ask for both documentation of the appointment and that the vaccine was given. It's only up to 4 hours. So if the person has some kind of reaction to the vaccine, it isn't going to help them with that. Then we're going to have to fall back on other leaves. But that is available to all New York State employees with one or more employers with one or more employees. Families First Act. This was set to expire on the 31st of March, but it has been extended through September 30th, 2021 on a voluntary basis. Okay, this is for employers with fewer than 500 employees. You can still receive that tax credit that you were getting. Employees will get a new bank of 10 emergency paid sick leave days starting on April 1st. You have to provide it to all employees, including part-time, if you're going to claim the tax credit. So you can't say we're only going to apply it to our exempt employees or some other category. You have to give it to everyone if you're going to claim the tax credit for it. But that will be available starting April 1st. And it's still available for the original reasons. I'm sorry, there's a typo on that slide. Can we use right in the middle? Sorry about that. You can still use it for self-isolation, to obtain a medical diagnosis because of quarantine, to care for a family member, or when the child school or childcare provider is closed. But you can also use it to get a COVID-19 vaccine and to recover from adverse reactions. So for those of you with fewer than 500 employees, you may choose to extend this starting April 1st for the 10 days because you want to cover that New York State sick leave of 4 hours that you're going to have to pay for, and at least that way you can get a tax credit. Now, that's not going to apply to anybody who gets their vaccine before April 1st, but a lot of people are going to be getting vaccines after April 1st, so that may be worth expanding it for that reason. It would also cover if an employee has an adverse reaction to a vaccine, it would give them some time to recover from that. In addition to expanding the 10 days of sick leave, the FFCRA emergency family leave was also expanded, and an employer can choose, again, this is voluntary now, an employer can choose to adopt that extra time. That would give you additional up to 12 weeks of emergency leave, and this applies whether the employer is covered by FMLA or not. So for those of you with fewer than 50 employees, normally FMLA doesn't apply. You can still choose to adopt the emergency family medical leave provisions if you want to. Again, up to 500 employees, you can do this as an employer. It's going to be up to 12 weeks now. It's paid at 2/3 of the pay of an employee's pay, and then the employer gets a tax credit for the amount paid. It's going to be eligible now, not just for the children out of school, but for any of these other reasons over here. So the self-isolation, the vaccine, the adverse reaction, okay? There's no longer a waiting period. So what we were doing before, where you had to take your 80 days of sick leave, and then you came back, and then you could take 10 weeks of emergency family medical leave, you now will have the 80 days of sick leave, and they'll get 12 weeks of emergency family medical leave. That raised the aggregate cap from 10,000 to 12,000. Now, if an employee has already taken some FMLA, it is going to reduce the amount of time they have available under this emergency. But again, this is something for employers to consider, particularly in New York, where we have the paid sick leave provisions for COVID. And I'm talking about the statutory New York sick leave. I'm talking about the COVID sick leave program. That is still in effect. It is not yet sunsetted, and so employers are still on the hook for that. You may decide you want to expand some of this FFCRA leave because at least you get a tax credit out. Before I go on to the topic of mandatory vaccines, are there questions on leave that anyone has at this point? Okay. I don't see any or hear any. So let's talk about mandatoriness of vaccines. This is probably the second question that everyone's asking me about. Can we make it mandatory? Should we make it mandatory? Is there a point at which we might consider making it mandatory if we're not going to do it right away? So let's talk about the issues surrounding mandatory vaccine. Right at the get-go, the EEOC issued guidance, and that guidance has not been changed under the Biden administration. The guidance generally permits an employer to require mandatory vaccines under the theory that the coronavirus is a direct threat to public health and safety. And so an employer can take measures to mitigate that direct threat. An employer must, however, consider reasonable accommodations for disability, reasonable accommodations for people who have religious objections, and there are some genetic information issues we need to cover when we're talking about a mandatory vaccine. But you can see, here's the general statement. It would be lawful for the employer to exclude the employee from the workplace if the employee cannot get vaccinated and there's no reasonable accommodation possible. So let's talk about reasonable accommodation for a minute. You as an employer, if you're going to do a mandatory vaccine program, need to have conducted a threat analysis and determined that the virus poses a direct threat to the public from your place of business. That's pretty easy if you have, say, tellers in a bank, or you have salespeople who are out on a floor, or grocery store workers on a floor. It's a little bit harder if you have backroom office workers, but the EEOC didn't really seem to suggest it had to be a very in-depth analysis. You will simply want to have documented what the threat is from the virus, okay? The vaccine can mitigate that threat, that's a given in the analysis. And then the question is there another alternative that would mitigate the threat for this employee? So when we're talking about reasonable accommodations, we have to consider if an employee cannot get the vaccine because of disability or religious objection, can they work from home? That would mitigate the threat. Can they work at a closed office environment where they have limited contact with people, and particularly the public? That might limit the threat. But you may not be able to eliminate or limit the threat in all circumstances. You still need to conduct the analysis to be able to show that you have attempted to accommodate either the religious objection or the disability objection. The next question is, once you've determined whether there might be a alternative, the next question is that alternative a hardship? And a hardship is something that's more than an inconvenience. So it might be inconvenient to have a data entry worker work at home, but it might not be a hardship if the only inconvenience is they have to record their time on a timesheet that they fashion. By contrast, obviously, you can't have certain people work from home. It would be a hardship because the business would not function in such a way. And you will need to be able to show that as well. Any questions about the EEOC's analysis? Okay. The last issue, and I didn't do a slide for this, that the EEOC considers is what we call the genetic information. This won't really apply if you're just asking employees to go to a state vaccination site and get vaccinated and provide you proof. It will apply if you are holding an on-site vaccine clinic. Because of the nature of the vaccines that we're talking about, certain genetic information is collected from participants getting a vaccine. I will just let you know, I'm one of those strange people who has a severe allergic reaction to certain vaccines. And because of that, I have to provide additional information when getting the COVID vaccine. That information would be genetic information that my employer should not know about and would not be entitled to act on. If they did so, it would be a violation of the Genetic Information Act. So you're going to want to make sure if you do an on-site vaccine clinic that you are not collecting genetic information or medical information. You're also going to want to make sure that as employees provide you documentation of their vaccines, they're only providing you documentation of the vaccine and not other information. So Some of you may have heard about concerns over the Emergency Use Authorization Act and the vaccines. There's been some commentary about whether employers can require EUA issues or use of the coronavirus because it's an EUA authorized virus. The coronavirus vaccine because it's an EUA authorized vaccine and not a fully authorized vaccine. And I've given you a little bit of information if somebody wants to go look at it from Harvard Law School. But generally speaking, neither the CDC nor any other government agency has said that employers cannot require an EUA vaccine. We'll talk a little bit more. There has been one lawsuit filed by an employee, and I'm going to talk about that when I talk about claims related to vaccines. So I want to encourage you, before you decide you need a mandatory vaccine program, to consider some questions. Why do I need a mandatory vaccine program? Well, it's strongly encouraging vaccines do the same thing. I have employer clients who have set up vaccine information systems for their employees. They provide either emails on a weekly basis with information on where appointments are available and what the status of vaccines is, or some of them have even set up web pages for employees to get additional information on their intranets about obtaining a vaccine. I would encourage you that if you are wanting your employees to get vaccinated and you do not want to do a mandatory vaccine, it's worthwhile to do an educational campaign. It's interesting to me that the statistic this morning on NPR News was that now 70% of adults say they will get the vaccine. That's considerably up from where we were in January, which was only 50%. The reality is the messages we send matter. And so if you are not going to do a mandatory vaccine, and I think most employers probably are not going to do that for lots of reasons I'll talk about, it is worthwhile to continue to normalize the getting of vaccines. It is worthwhile to have your leadership verbally and in other ways publicize that they are getting vaccines. The subtle mind shift from the vaccine is a scary thing to the vaccine is a normal thing that everyone does is really important when we're talking about this topic. So whether you're going to do mandatory or you are simply going to encourage employees, I would encourage you to come up with a way to really normalize the getting of vaccines in your workplace. The next question you should ask yourselves is the need for mandatory vaccines universal or specific? And by that, I mean, do we really need everyone to get the vaccine, or are there certain groups of people? For instance, salespeople who go to and work on the on-site of another client. Maybe we want them vaccinated because they're at much higher risk. Public-facing employees, healthcare workers, are they in positions where we want to push for vaccination more strongly or require it because of the nature of their work? And maybe we don't need to require the secretary who sits in the office by herself to get vaccinated. What process will you use for requests for accommodation? You should have that set up well in advance of requiring vaccines in your workplace. You should know who's going to handle those requests, what documentation you will require, and what you will do with them, how they will be evaluated. And that really should just be part of your push out of your mandatory vaccine policy, is how to request a reasonable accommodation should be ready. What will you do if someone has a serious side effect? I'm going to talk a little bit about workers' compensation and mandatory vaccine programs, but what else will you do? Will you give the employee time off from work beyond what maybe is required by statute, paid? Will you assist them in obtaining medical care? What else might you do if an employee ends up having one of those serious but rare side effects? I want to encourage you not to ignore the National Labor Relations Act. If you are a unionized employer, you are likely going to need to bargain over mandatory vaccines. But if you're a non-unionized employer, you might be affected as well. There have been at least some charges filed against non-unionized employers in other states, not in New York so far, where the employees got together to protest a mandatory vaccine program and the employer fired them. Be aware that employees coming together to complain about their conditions of work, which would include a mandatory vaccine, is protected under the National Labor Relations Act. You can't fire them for doing that activity. If you end up with one of these situations, I'm going to encourage you to consult counsel, because this is a very sticky issue, sticky area of law. Now, I'm a lawyer, so I tell you all about the legal issues, but here's one that isn't really a legal issue, but might be the most important consideration of all. What about employee morale? I told you that as of this morning, the number of adults who say, or the percentage of adults who say they're going to get the vaccine has risen to 70%. That's still not 100%. And that means there's probably a good number of people in your workplace who are not going to be willing to get the vaccine. Are you going to be willing and are not going to be able to show a need for accommodation? Are you going to be okay with terminating that person? What are you going to do about the morale issues that might cause? On the other hand, if you're not requiring the vaccine and you're in a fairly high risk environment, are there morale issues with that? I think my employer should be doing more to protect me. Those are considerations you need to make based on your individual workplace and the kind of people who work there and the attitudes that you are seeing. So let's talk about the bottom line. Employers can have a policy requiring vaccines. You have to consider accommodations. You're going to want to consider the impact on the workplace, and you're going to want to watch for additional guidance on this emergency use issue in case any comes out. Does anyone have any questions that they would like to ask at this point about mandatory vaccines before I move on to claims? Okay. You're all saving them for the end, I know. Let's talk about claims related to vaccines. The past month has seen the first lawsuit related to mandatory vaccines. New Mexican Detention Center officer filed a federal lawsuit challenging the right of his employer to require first responders at the facility to get COVID-19 vaccines. Originally, the court had set an expedited briefing schedule that would have had all the briefs due by March 19th. But the parties agreed voluntarily to terminate that expedited briefing schedule. I'm going to guess, without knowing any more, that the employers agreed to keep the employee employed during the pendency of the lawsuit. And the lawsuit will move forward in its normal fashion to determine whether mandatory vaccine is required, or whether there's any sort of claim. The employee's challenge is brought under the emergency use authorization provision. He is alleging that the employer cannot require the vaccine because it was only approved under an EUA. And that makes him, as I believe he put it in the lawsuit, a guinea pig. So that lawsuit is out there. It's the only one I could find as of last night that has been filed, but there's probably going to be one or two more. Perhaps the larger issue that I'm seeing people discuss now, as we do see some and understand, we've had millions of people vaccinated and there's only about 900 cases of serious side effects that have been reported. But that raises the issue of workers' compensation, because as an employer, if we're requiring vaccines to be done and the employee does it because it's for our business, then we might have a workers' compensation issue. So there's a number of questions about what would cover employers in the event of an adverse reaction or side effects to a vaccine. One is, was the vaccine mandated by the employer? If it's mandated, it's more likely to be covered by workers' compensation. Was the vaccine administered at work while the employee was working or being paid? Again, that's going to make it more likely that vaccine reactions are covered by workers' compensation. Did the employee, for personal reasons, undergo the vaccine? That's going to make it less likely that it was covered by workers' compensation. And then, of course, the question in all compensation cases, did the side effect rise to the level of serious injury? It may not. A swelling for half an hour or even a day or two that does not impact the employee's quality of life probably doesn't rise to the level of serious injury. Bottom line is that if you're thinking about a mandatory vaccine program, I encourage you to reach out to your workers' compensation carrier and discuss with them what impact that might have. Any questions about the claims issues before I move on to other issues? Okay. Well, I have to say I found a whole lot of pictures of people getting vaccines this time that I could put in my slideshow. Lots of fun. I do have a question about on-site vaccine. If you have an on-site vaccine clinic and it's voluntary, would workers' compensation still apply? It's a really good question. I don't actually know the answer to any of these questions because there haven't been any claims that I'm aware of filed with workers' comp because of vaccines. But that's something I think you should make your workers' comp carrier aware of and ask them if they have any thoughts on what they would do if you get a claim, just so that you're prepared and ready to go when you have that clinic on site. I suspect the answer is no, that it would not be covered by workers' compensation because it's completely voluntary and not required by work, but you never know. Here's another question I get asked a lot. I've decided to have a voluntary program. I'm not going to require people, but I would really like to know if we're doing well getting people vaccinated, or if we maybe need to do more information in, or maybe we need to consider making certain groups mandatory. Can I ask for proof of vaccine status? And the answer is yes, you can. The EEOC said that asking simply for someone's status, whether they are vaccinated or not, is not a disability-related question. There's some additional guidance provided there in that K3 about what you can and can't do and how to word the question. Be very careful though. You cannot ask someone why they are not vaccinated. That is a disability-related question because it's likely to raise medical issues for the employee. Now, their answer might be because I don't believe that the vaccine is real, but it might be related to a medical, and so you can't ask why they're not vaccinated. But you can absolutely ask employees to provide you with proof of vaccination status. That raises a question for me. And this question comes a little bit outside of my normal employment hat, but it comes with my cybersecurity hat. What will you do with that vaccine information? How will you appropriately store it? I don't want it sitting around in an unlocked file cabinet somewhere. This is somebody's, in part, medical information. It may say something about them as a person beyond medical information, depending on what you think. But this is private information. So you as an employer have a right to ask for the vaccine status, and you can keep that. But you need to have a plan for where you're going to keep it and how you're going to keep it. Wow, I got a bunch of people vaccinated and now they don't want to wear masks in the workplace. So sorry, that's a no-go. OSHA has issued their safe work rules relating to the coronavirus and the vaccine. If you have not been paying attention to what's going on at OSHA in the last month, you really should be. They have increased their inspections dramatically. They have increased their citations and fines dramatically. They really are looking at the coronavirus. They have issued emergency guidelines related to the coronavirus that are now applicable in workplaces and can be used to cite employers with regard to issues in the workplace. So you really do need to be looking at what's going on at OSHA if you haven't already. But this is what OSHA said, and this is taken directly out of their guidance. It is important to wear a face covering, remain physically distant from coworkers and customers, even if you have been vaccinated, because it is not known at this time how vaccination affects transmissibility. Their position is that face masks and social distancing are still required even if you are vaccinated, even if employees are vaccinated. And there is some evidence that perhaps I have my vaccine, and that means that I don't get sick and I don't get hospitalized, but it may not mean that I don't get the virus and cannot transmit it to other people. I've seen a number of articles coming out on this, and of course, we're going to know more and more as time goes on, and we see how these vaccines affect people and affect the workplaces. I have a question about where to store that vaccine information. Most of you will have some kind of files that you use for medical information for employees. I think it's appropriate to store them in there. If you are trying to create simply a place where you store just vaccine status for everyone in your workplace, I think that's okay to do for yourselves so that you can easily access it. But in that case, You're going to want to make sure that that's that is a secure location. So if it's a computer file, it's some kind of secure file. If it's a physical file, it's some kind of locked box. Oh, great question. If an employee is vaccinated and then exposed to someone positive, do they still need to quarantine? What are we going to do? So and the second question is this New York State's decision or ours? So in the first place, you as an employer can always set rules that are more restrictive than New York State's. And that means that you could still require someone who is exposed to the virus to quarantine, even if New York State ultimately decides not to. At this point in time, New York State has not changed the rules for people who are vaccinated and with regard to quarantine. I suspect they will change as time goes on, but at this point, even if you are exposed to the virus, even if you are vaccinated, you are still going to have to quarantine for 10 days. And that goes back to this question of, if you are exposed to the virus and are vaccinated, can you still contract it and spread it even if you don't ultimately get sick? And that's really the question we need to answer at this point and have not yet quite been able to do so. I do think that we will see probably in the next 2 weeks some additional guidance on this issue of quarantine with vaccinations. I believe we're reaching a much more critical mass point where many more people are vaccinated. I will also say that when you're looking at why might I want to know the vaccine status of my employees, this is probably the number one question. Because here's the issue. If I get contacted as an employer by a contact tracer from New York State, I want to be able to say these 3 people were potentially exposed, but these 2 were vaccinated before exposure, fully vaccinated before exposure. And they were vaccinated fully by X date. And does that impact their contact tracing? And it might well. I have not seen any guidance from New York State on this yet. I suspect they've been a little busy in the last week or two trying to open businesses and get vaccines, the age limit for vaccine down. But I absolutely think that will be Cuomo's next press conference a week or 2 from now, is what effect this has on quarantine. So what should you do now as an employer? What do you do now that you are thinking about this issue? I really think all employers should have a vaccine policy. It might be a mandatory policy, but more likely it's going to be some kind of a voluntary policy that encourages vaccination, asks for status to be provided, makes suggestions on what employees can do with regard to quarantining if it affects it in any way, okay? I think you want to have resources available for your employees if you're trying to encourage vaccination. You want to have that plan for what to do with your vaccination statuses. You're going to have to continue to exercise appropriate precautions. I did see that the director of the CDC issued what he called dire warning today that we are entering a very risky period of time. He believes that while the vaccine will do much good, the idea of vaccination might also do some harm because people will become lax in taking care of themselves and exercising precautions. And, I think the workplace is a place where that's likely to happen. Look, I'm tired like everyone else of wearing a mask every time I leave my office. I'm tired of not being able to go have a drink at happy hour with my coworkers. It's a frustrating thing for a lot of employees, especially in businesses that many of you have where their social life really revolves around work. And so we're going to have to be vigilant. We're going to have to do reminders. We're going to have to maybe sometimes be the bad guys in terms of asking people to put their mask back on, or reminding people that we need to have more hand washing because the soap isn't quite going down as fast as it was. Whatever that is in your workplace. And then, of course, one of the best things we can do if we're encouraging our employees to get vaccinated is get vaccinated when the time comes for you. Not directly related to vaccines, but I can't help this. This is probably my happy moment of the month, was the changes to the quarantine rules for travel. I no longer have to sit down and figure out whether somebody's travel does or doesn't meet the quarantine rules. And if they're in Massachusetts for 3 days, after they're in another state for 4, does that count in terms of getting them out of the quarantine? I'm so happy. We are 2 days away. This is Thursday, folks. After Thursday, no more quarantine for travel. Domestic travel does not count for international travel. But I just have to bring that one up as a happy moment in all of this. And I will take any questions that you have. I got some in the chat. Not sure I 100% understand the question in chat. There are some questions about returning people to work. And that might have to do with workplace density requirements that have not yet been lifted for office buildings, and we're not sure why not. If we can go back to restaurants, it sure seems like we ought to be able to go back to office buildings. I do think many of those density requirements will be lifted pretty quickly if they haven't already tacitly been lifted for office buildings, simply because Cuomo seems to be lifting all of his executive orders in an effort to stay in his job, and his emergency powers were taken away. So, you know, I don't know that vaccination necessarily affects that issue of the density of your workplace. Other than for you, it will likely decrease the number of claims that you have for people having contracted it in the workplace, and therefore less than the number of reports you have to make to OSHA on the issue. Is quarantine for domestic travel, is that no quarantine? Is that required only if people are vaccinated? The answer is no. That will apply across the board. You do not have to be vaccinated to avoid quarantine for domestic travel. Masks and distancing mandates the same for indoors and outdoors. They are not necessarily the same indoors and outdoors. 6 feet is the rule. If you can't distance, if you can't stay 6 feet apart, you're supposed to wear a mask. So that's going to depend on your type of business, your place of business. You know, if you're running the state park, maybe masks aren't required when people are out in the trails, but otherwise they might. Question on travel. Can you as an employer recommend quarantine after travel? The answer is yes. You can still as an employer require quarantine after travel. Of course, if you do so in the state of New York, you are going to be subject to New York's newest rule, which is that if you are requiring someone to stay home from work for any reason related to the virus, you have to pay them. In that case, if you're going to do that, you might want to strongly consider expanding the FFCRA leave so that you can at least take a tax credit for that required time that they're staying home quarantined. There's some questions about the mandatory vaccine policies and employees who are opposed because it's authorized under the emergency use. That is an open question. So far, no government agency has said that you cannot require the vaccine because it's only authorized under the emergency use. And there is the one lawsuit pending in New Mexico. I don't know how that will turn out, but it doesn't seem that anybody is particularly sympathetic to that argument. Of course, you'll have to do with that risk analysis what you will as an employer. We take risks all the time when making decisions. I think it's probably a pretty small risk to require vaccination, other than you may lose the employee who will not be able to, or who will not be willing to be vaccinated. You will have to turn. I got a question on CDC recommendations for travel. CDC does still recommend or require quarantine for international travel to level 2 and level 3. I'm not aware of any CDC guidance that requires quarantine within the United States. Just to make everyone aware, I don't have a question on this, but it's something that a couple of clients have run into. Just be aware that there's some ambiguity with regard to US territories under the CDC's guidance. That would be Guam, the Virgin Islands, Puerto Rico. New York does not require quarantine for going to those places, and it hasn't for some time because the transmission rates are relatively low there. And they were on the safe list at one point in time, but it's not entirely clear whether they're a level 2 with regard to the CDC's list. So do with that what you will. A lot of people have said they're just going to follow what New York State says. Some people have said they're following the CDC's. Some employers are just not going to require quarantines other than as required by the CDC. Yes, the travel, if you require quarantine for travel, because of travel, no, you cannot require them to take their PTO. That's the New York State's rule. So if an employer, if you require somebody to stay home because you believe they've been exposed to COVID and they're not under a quarantine order, you have to pay them, and you cannot use their PTO or their New York sick time to do that. I'm getting a lot of quarantine questions. I'll answer them as the best I can. If anybody has any vaccine questions, you're welcome to ask those as well. So I've got a question about quarantining. The current quarantine requirements are that it's 10 days from the date of exposure or 10 days from the onset of symptoms for the person. So if somebody lives with someone and that person has coronavirus, it's going to start out being 10 days from their exposure to that person. If they then develop symptoms at some point, the time is going to change and it's going to be 10 days from their onset of symptoms. Okay. So if they're living with the person on day 1, it's day 10. And then if they develop symptoms on day 3, now it's day 13 before they can come back to work. Have to be symptom free. For at least CDC says 48, New York State says 72 hours. Okay. I'm not seeing any more questions. I'll stay on and answer any that come up. Kyle, will the slides be made available?
Yes, if you're willing to share the slide, we will send them out to folks. And I did just want to thank you, Dawn, for taking the time out of you. I know you have a very busy schedule, so thank you for taking the time and doing this for our chamber members today. We greatly appreciate it.
Well, thank you all for having me. I wish you all a nice sunny day out there. It looks like a little bit of heat before we go into another freezing cold weekend. I do love spring in upstate New York. And of course, you're welcome to reach out with any specific questions related to your situation. And just keep track, that the chamber, both the chamber and HHNK are trying to do updates as we get information on these topics related to the virus. At least this year in April, I can smile a little bit while talking to you. Last April, it was a little darker when we were all talking together. So I am thankful for that. For those with spring break, have a great spring break next week.
Thank you.
Thank you.